Hello, ladies and gentlemen. I'm Coralie Whitby. I'm the Education Coordinator for the Embryo Adoption Awareness Center and Nightlight Christian Adoptions. And this morning we are very, very pleased to bring you the webinar entitled You're the Expert, What Your Patients Expect. And here's our presenter today. It's Miss Megan Fabian. And I can tell you that I know that Megan doesn't look like this anymore because she is 8 months pregnant, expecting her first. So we're all very excited for Megan and looking forward to adding to the Nightlight family. Her current position, as you can see, is the Manager of Development and Outreach for Nightlight Christian Adoptions. Megan is also the Director Emeritus of the Snowflakes Embryo Adoption Program. She's worked with the Snowflakes program for over 8 years, and during that time had daily contact with embryo donors, recipients, embryo recipients, and art clinics. And now for a bit of housekeeping. We want to point out the technical support number at the bottom of the screen, and you might want to write it down. I don't hear anything. Pardon me. If you are experiencing technical difficulties, that is the number to contact. And so write that down and keep that handy. Now to submit a question, you will enter the text in the text box and you'll push the send key. During the presentation, all participants are in a listen-only mode. And I encourage you to submit your questions at any time and when you think of it, because you may not remember it when we come to the end of the presentation. If you happen to be in the full screen view, you can click on the question mark icon on the toolbar in the lower right-hand corner of the screen. This will open the Q&A panel on your screen only. When you submit your question, it will be visible to all of the panelists, but not visible to the other attendees. And we expect the presentation to last approximately 45 minutes with 15 minutes for Q&A, and we will be distributing a white paper of the presentation to all our attendees. And if you are listening via phone line, could we please ask you to put your phone on mute because we're hearing background noise, and all of our attendees are hearing the same noise. So,
yeah, that's Barb and Suzanne. Would you please mute your phones? Thank you.
All right. So I am going to throw the presentation over to Megan at this point, and we start here with the goal being a baby.
Okay, good morning. Thank you for all joining us. Thank you, Coralie, for the lovely introduction, and I'm happy to be presenting to you all today. So this presentation, we're talking about how the goal is a baby, and that would be for both clinics and embryo adoption programs. So we know that reproductive endocrinologists and the staff members that work in assisted reproductive technologies want to help their patients achieve pregnancy and have a baby. That's everybody's heart's desire when they embark on the fertility clinic journey when they're patients, and we know that the doctors and staff are working hard with them to help that be possible as soon as possible. Embryo adoption agencies and their personnel have the same goal. They want to help clients experience pregnancy and childbirth and bring home a baby. So all the clients that call Snowflakes are looking to have a child or another child, and we work hard to help them make that possible as soon as possible as well. So we're all working towards the same goal. So let's take a look at the ART clinic. Helping patients have a baby. The goal is pregnancy, and the staff at the clinic is going to assist the patients in achieving pregnancy if at all possible. And the treatments that are looked into with the patients are probably the least invasive at first and leading up to the more invasive as they move forward, but always they're looking at the likelihood of success. So that's fertility clinics' focus when they're talking with patients. Obviously, fertility treatments are costly and emotional and time-consuming too, so we only have a certain number of months every year. We want to help the patient achieve pregnancy as quickly as possible and with as least cost possible, and with something that they are comfortable with. The treatments, clinics present treatments to patients that have a high success rate and are readily available. And often these will be IVF or donor gametes, often donor eggs, because it's quite likely that part of the fertility issue going on might be the mother's age or other factors that are attributed to eggs, and donor eggs are something that we have readily available in the United States. So the success rate under using donor eggs is high, and doctors are comfortable presenting that option to their patients because of the high success rate and the likelihood that they can help them achieve a pregnancy as quickly as possible. Donor embryos may or may not be discussed, and this could be for several reasons, which we'll look at later, but we want to help bring some awareness to why it would be very good to discuss donor embryos with the patients. So let's take a look at the infertility patient, and this picture shows a couple. They look a little stressed because infertility can be quite stressful. There's tension in the relationship, and that's part of what they bring in when they're coming to seek treatment. Infertility can often be overwhelming. Patients feel lost, confused, unsure, unclear, perplexed, disoriented, and bewildered, and I'm sure a multitude of other feelings. Patients have physical, spiritual, financial, and emotional needs, and we're going to look into those each closer in the coming slides. But we just want to make sure everybody's on the same page, realizing that patients are usually overwhelmed and a lot of emotions are going on during this time. So some of the physical needs that the patients have are what is going on in their infertility. What are their bodies doing? Why haven't they been able to conceive so far? What are their medical needs? And then what kind of treatments can they explore with respect to their physical factors? So obviously if there's, like I've heard some patients say, an issue with the plumbing, maybe a donor sperm or donor egg might be the route that they want to go. If there's an issue with hormones, obviously we can do things about that. If there's an issue with, the uterine lining, et cetera, there are different ways to treat things like that. So their physical factors will help determine, or will be a factor in deciding what treatments are available to them at all. And what are all their treatment options? So when we have somebody who's looking into maybe donor egg or donor sperm or maybe both, sometimes embryo donation might be the right answer for them. Spiritual, ethical, and moral needs. Now, every patient brings their own moral and ethical values into a clinic every time they walk through the door. And what do they believe and how their beliefs influence their fertility choices are going to be big factors for them. For people who have some belief or no belief or very strong beliefs, all of these factors or their values, their moral compass is going to guide their choices for fertility treatments. And that's something that is maybe not talked about openly in the clinic, maybe talked about more at home with their partners, their spouses, but it definitely influences their choices on what they're going to do moving forward with fertility. So let's take a look a little bit deeper at Roman Catholic patients. There is a misperception among many Roman Catholics about the stance of the Church regarding embryo donation and embryo adoption. And while the Church has taken a stance on IVF, there has been no official proclamation on embryo donation. So we did have several Catholic patients through the Snowflakes program, or we have had, and I'm sure we'll have some more, who really prayed about things and spoke with their priest and came to the conclusion that basically they were adopting a baby before it was born and giving it a womb to grow in and a family to be raised in, and that was perfectly acceptable to them. We have some available resources through the Embryo Adoption Awareness Center, and we are going to make those available to you at the end so that you can have them on hand in case you would like to have more resources on embryo donation and adoption and the Catholic experience. We have evangelical patients, so evangelical Christian patients. These patients may be hesitant to create new embryos because of their view on that life begins at conception. They are often pro-life and view embryo donation positively because they have a high regard for the embryo. So a lot of patients that we worked with fall into this category, and they have come to us because they've said, you know, we explored IVF, but we don't feel comfortable creating more embryos because there are already embryos out there, and we like to adopt some of the embryos that are there and give them a family and have a baby that way. Or we also have people who did do their own IVF and did create embryos, but they didn't become pregnant, they don't have any embryos left, and then they learn about embryo donation and adoption and realize that this is the answer to what they were looking for. We'll take a look at Jewish patients. We have worked with some Jewish patients through the Snowflakes program, and some Jewish patients require Jewish gamete or embryo donors, which is interesting, and often embryos are not labeled as such. Snowflakes has not run into quite a problem with that because our donors and recipients are able to choose each other. So through letters and pictures, they can get to know one another and certainly have time to ask questions about faith backgrounds if it's not shared up front, but honestly, usually it is. So Jewish recipients have been able to match with Jewish donors and feel comfortable that they're receiving embryos that come from Jewish heritage. But embryos, if you're doing an anonymous embryo donation, oftentimes I don't think the embryos are labeled with the Jewish heritage, so that might be something to look into as clinics are moving forward. People of many diverse spiritual backgrounds have beliefs which play an integral part in their treatment consideration. So that's kind of reiterating what I mentioned before. Everybody's going to have some kind of moral compass or value compass that's guiding their decisions, and it's quite important for clinics to be aware of those beliefs and feelings because they do heavily influence patients' choices or decisions. Okay, we look at financial needs, and I think everyone is certainly aware that finances are a limiting factor for most people. What is the patient's financial situation? How much are they willing to spend to carry a child? How much are they willing to spend to have a baby to whom they have a genetic connection? And these are all really important questions to be discussing with the patients, or at least being aware that the patients are discussing among each other, or with their friends if they're doing this on their own. The patient's financial situation is obviously going to, if they have limited finances, it's going to limit their decisions about how much they can spend. Some patients I've talked to have said we don't want to go into debt with our fertility treatment because we try to live out of debt, so we need to save up for what we're going to do, or we have saved up for what we're going to do. Some patients are very interested in carrying a child, and it doesn't matter to them about the genetic connection. So maybe a sperm donor, egg donor, or a donated embryo would be appropriate. And then other patients really want to have that genetic connection to their child. That's the most important thing, and they'll go to great lengths, including hiring a surrogate, et cetera, to have a child that has a genetic connection to themselves. So the issue of finances, it's obviously a very personal issue. Patients may be embarrassed and not ask questions, leaving clinic personnel unaware that the financial cost of what was presented is out of the patient's reach. And this may cause the patients to leave and not come back. depending on what they go home and research and find out what else they could possibly do. I have certainly talked to people who want to fly to India, which seems like a great expense, to do an IVF cycle over there because it's less expensive. Presentation of all the patient's options may provide them with a path that fits their financial abilities. So I know a lot of people have called snowflakes talking about the cost of egg donation and how that was presented to them as a viable option for achieving a pregnancy in a reasonable amount of time, but they just simply couldn't afford the egg donation procedure, and they were looking for something different. So embryo donation is typically much less expensive than egg donation, and they found that the Snowflakes program better fit their financial needs. And now we're going to look at emotional needs. So what is important to your patient? Some genetic connection to the child, an equal genetic connection to the child by the parents, and those are different. Some genetic connection could be just one spouse or partner, and an equal genetic connection would be both partners are equally genetically connected, or neither partner is genetically connected, and that would be equal. Or knowing that they did all they could before moving to the next step. A lot of people want to try, some hormone replacement before they do, any type of invasive medical procedure, or they want to do, donor, or not donor, but artificial insemination cycles before they move to the next thing. And some people definitely want to try IVF even if they have a very low chance at success, because they want to know they did all they could to create a child together before they look at donor eggs, sperm, or embryos. Most of all, it's really important that husbands, wives, partners are on the same page. So this is, again, something that might not be discussed a lot in the clinic, but I think clinic personnel are very wise to know that patients go home and talk with each other. And a lot of times there's some, I think most often, the wife is kind of driving the fertility treatments, and often the husband says, okay, well, whatever you want, honey. But it's really important that they're both on the same page really concretely about what they're getting into, if they are or are not going to have a genetic connection to the child, how that might affect their emotions moving forward, might affect them psychologically as they're raising the child, and to just get counseling to make sure that they're both in firm agreement about what they want to do, why they want to do it, and how they're going to handle different questions moving forward as the dream of a baby actually becomes a baby who actually becomes a child and an adult. So counseling or other resources may be very helpful, and actually the Embryo Adoption Awareness Center does have a resource for that if the clinic doesn't have counselors in-house or referral sources. There's a page on the Embryo Adoption Awareness Center website which we'll give you at the end, and it has links to fertility counselors throughout the United States. So we are talking about emotions and what emotional considerations are important for your patients regarding the use of donor gametes or embryos. We talked about this a little, but just to reiterate, the ability to connect with the genetic parents of the child, is that something that's important? That would be, if they are interested in that, they're looking for more of a direct donation or an open donation, and they would want to maybe go through an agency or another maybe friend of a friend type of source so that they can have the ability to connect with the genetic parents of the child. The ability of their child to know the genetic siblings. Are they interested in that? I do have a couple families. It's really cute. They get together every once in a while because the kids know each other. They're all born from the same embryos, and they want the children to grow up having at least some type of friendship with each other. Or the ability to have an anonymous donation. Sometimes that's really important to patients, and they don't want to know where who the embryos came from. They don't want to have a connection, and they would like to do something anonymous. So Snowflakes is able to facilitate those as well, although we do encourage some type of openness for the benefit of the child later on with regards to at least medical history and psychological health. An equal genetic connection. This is something that I hear a lot from people who call snowflakes. Many patients find their way to embryo adoption agencies because they have an innate concern regarding moving forward with treatment in their ART clinic using donor gametes. And they have expressed that they desire an equal connection to their baby, even when that means there's no connection. So I've heard a lot of people say, well, we looked into donor eggs, but we didn't feel comfortable having my husband be part of the child and me not. Or the other way, we've looked into donor sperm, but we didn't want me to be connected to the child and my husband not. So they felt more comfortable doing a donor embryo cycle or an embryo adoption because then neither one would have connection and that put them on equal ground. Presenting all the options. We're going to take a look at why it's important. Egg donation or embryo donation. For many patients, embryo donation through an adoption agency may be the answer they're looking for. And why might this be? It might be the availability of the donor embryos, the cost. It is significantly less expensive to do an embryo donation program, and then the equal genetic connection. So all of these factors might push a patient to do embryo donation versus another type of fertility treatment, especially if they're looking at donor gametes already. What if the option of donor embryos is not presented to the patient? The information superhighway. They will go to the internet, which, let's be honest, is probably on the internet already. That's likely how they find the clinic if they didn't get into referral from a friend. But patients are going to turn to the internet if they feel unsettled about the options presented at their clinic. So they go to the clinic, they speak with the staff, they get the information about what kind of fertility treatments are available to them, what does the clinic provide, and if they go home and they look over everything and recount their conversation and just think, you know, none of these feel right to us, I don't think we can do this, whether it's financial or emotional or spiritual reason, they want something different. So if they go to the internet looking for something different, maybe through another clinic or another program, there is always the danger that the patient learns erroneous information. We all know that not everything on the internet is true. So I, of course, have had the experience of hearing people say things that they learned online, and I think, oh my goodness, that is not true. Where did you hear that? And it just, you know, they come up on these chat boards and everything, so who knows. But it's much better if they can get the information from the experts, which are you. The problem of bad information can be limited if clinics are providing information on all the options available to patients and providing sound resources. So when the patients are speaking with their clinics this day, if the clinic does include embryo donation as an option and has you know, even just a list of the different programs available in the U.S., which is readily available on the Embryo Adoption Awareness website, then the patients at least know that this is an option to consider and they can look into the details themselves. And we understand that clinic personnel sometimes do not know the facts, and this is something that we heard from a fertility counselor. Barbara had said, you mean you guys have embryos available that my patients could receive now? And she just wasn't aware. So we know a lot of clinics aren't aware. The Snowflakes program usually does have an abundance of embryos we're looking to place with the recipient couples because we get a lot of calls from embryo donors. And doctors seem to tell their patients or believe that there aren't a lot of embryos available. So that's one of the reasons maybe that they don't include embryo donation as an option, but the truth is there are embryos available. Omission of information, that's something else we should keep in mind. When patients learn other options are available besides treatments recommended by the clinic could potentially lose a patient and the chance to continue with a treatment that better fits the patient's needs, depending on what the patient finds as they go online and look around. They might find another clinic that provides something they're more comfortable with, or says something about embryo donation on their website, so they call them and end up working with them. The patient may have a negative perception of the clinic if they feel they did not receive the expert information they expected. So just other things to keep in mind when choosing what to include in the fertility treatment options. We heard from a patient, Nicole, I would love to do that, which she was referring to adopting an embryo, but where I live, I was told that there is a waiting list of years because there are so few embryos available. So obviously Nicole had heard that the lines were very long to receive donated embryos, and that might have been her clinic's personal experience, but we want to reiterate that through the Snowflakes program, there are embryos available, and the waiting list is not years. It's, certainly, I would say 100% of our recipients are matched before a year. Most people have a baby before a year, at least have a transfer before a year. So Nicole was unfortunately misinformed and didn't go forward with an embryo adoption program. Patients who feel they were uninformed can and do take their issues public. So we found some quotes from the internet. This woman named Ria said IVF was $15,000. IVF using an egg donor was approximately $25,000. We paid $40,000 out of pocket in our attempts, which is not abnormal, I don't think. I honestly wasn't aware of embryo donation. My clinic never told me about it. I wish I had been because the cost is much less. And more on taking their issues public. Another woman, Kirsty, said we ended up doing donor egg IVF. Only after the fact did we find out that our clinic did have a donor embryo program. So I don't know what the result of her treatment was, but it sounds like there's a little bit of regret that they didn't know about the donor embryo program, maybe because it is less expensive, maybe because they would like to have had an equal genetic connection to the child, but it seems that their clinic didn't express that option to them at the time. Another quote from a clinic review website said, and she didn't leave her name, sad to say, I have had enough experience with other REs that I can actually say with certainty, do not come here. I'm saying this because I expect my doctors to stay current on infertility causes and treatments and to welcome my input and questions. So I don't know exactly what her situation was or what she went through, but it just goes to show that people do feel frustrated when they feel like they haven't been given all of the information available. Patients' expectations. So you can see here in the background we have some pictures of the brochures regarding embryo donation and adoption. And we understand as a program that knowledge of exact protocols, current embryo availability, and program costs are certainly out of the clinic's realm. There are several different programs around the United States, and it's not reasonable to think that clinics would know all the details about how those programs operate, exactly what the costs are, etc. But patients do expect that an art clinic knows about all their options and can point them in the direction of available resources without knowing detailed information. So as I mentioned earlier, it could be sufficient just to include a list of the embryo donation programs out there so the client or the patient can further research the details on their own. At least they would know that they're there, and if they feel like it fits their needs, they can participate, and if not, they can at least just cross it off the list. So we want to invite you to let the Embryo Adoption Awareness Center help you. We have tools to help you educate your clients. We have, as you see up here on the right, Embryo donation and adoption, the fundamentals. That's the first page of one of our webinars. It talks about embryo donation and adoption and guides patients through the process in general. It's also helpful for clinics if you want to learn more about the basics of the process. On the left, we have a screenshot of our website. So obviously there are lots of resources on the website. In the middle here, we have the Did You Know video, which talks about a lot of different facts regarding numbers of embryos and costs and things like that regarding embryo donation and adoption. And then we also, in the lower right, you can see contact with a family who has experienced embryo donation or adoption. That's something unique that the Embryo Adoption Awareness Center can help with. If you as a clinic or an agency have never had anybody go through embryo adoption, it is really hard to tell people what it's like. You don't know. So it's helpful for your patient if you can put them in contact with someone who has been through it. They can get a personal experience. A lot of people really appreciate that. And the Embryo Adoption Awareness Center is able to connect prospective patients looking into it with people who've already done it. And then at the bottom here we have a snapshot of the Embryo Donation and Adoption Awareness Center blog. So there's a blog online that people who want to stay a little more anonymous can read and participate in if they'd like to get more information. Those are just a few of the websites or resources available. And focusing on the patient. So let's take a look further into focusing on the patient. Exploring your patient's needs. Obviously, this is something that clinic staff would, it would behoove them to do. I'm sure a lot of you already are. This will help the patient make the single best family building choice for their needs. And again, of course, the patients might choose one thing and then move to other things as they progress through their fertility journey. But really being compassionate and sensitive about exploring their needs, especially the different needs we discussed, religious or moral values, the financial aspect, the emotional aspect, and the physical aspect, which is a given, leaves the patient feeling they received expert care from their clinic. Embryo adoption programs have embryos available today. Another thing, again, that we want to highlight, while this may not be the first recommendation presented from a medical standpoint, it may be the option that fits your patient's physical, moral, financial, and emotional needs. So that's something just to keep in mind, that it might be the right option that's maybe being left out. And building families. Again, fertility clinics and embryo adoption programs both want to help their respective patients and clients have the baby they have always desired. So just to reiterate that we're all on the same page together. And that wraps up the webinar. So we want to invite you to submit questions online, and I'm going to hand this ball back to Coralie so that she can tell you more about that.
Okay, so once again, everyone, if you would like to submit a question, you're going to type it in the text box in the bottom of your screen and click the send button. And if you don't see that box and you happen to be in the full screen mode, then you click that little question mark icon. So I do see a couple questions coming in, so let me move to our future events. This webinar is back by popular demand, and it has been revamped and is going to be brought to you on April 17th. And it is Legal Issues of Embryo Donation and Adoption, How to Limit Clinic Risk and Liability. And this always gets a lot of playback on our website. People are coming to this webinar often, and it is as you know, at the clinic level, it is something that we are always looking at with everything that we do in the embryo adoption industry and in your industry, is the legal risk and liability that we are opening ourselves up to. So, Megan, I do have a couple questions for you. The first one is, do you have experience working with Muslim clients or patients?
That's a great question. I think we have worked with a couple of, maybe one Muslim family. We have certainly worked with families of different religious backgrounds. So whether it be atheist or Buddhist or Muslim, that we've definitely worked with different religious backgrounds. And really the program is designed so that clients can select each other. So it doesn't matter to the Snowflakes program what religious background the clients are coming from. It just depends. We'll be very honest with them about the likelihood we see of them making a match in a reasonable amount of time, and based on who we've worked with in the past, et cetera. But we certainly welcome families of all different faiths.
Okay. And we have another question here, Megan. Do you work with couples that want to adopt embryos but need a gestational carrier?
That's another great question. Yes, we do. We provide the embryo adoption service, so we will connect the intended parents with embryo donors, and then the intended parents would need to make their own arrangements with a surrogate, whether it is somebody they know or someone they're being matched with through a surrogacy agency or attorney. But they need to do the legal part of surrogacy on their own, but we'll match them with the embryo donors, and the donors will certainly be aware of the fact that they're using a surrogate to carry the baby. But that has certainly been done, and it's been successful, and it's been a happy story for everybody.
Okay, thank you.
Yeah.
Megan, here's another one.
Sure.
We were trained to presume that patients want to have some genetic connection to the child. Is
Sure.
it really as common that people want no genetic connection as you seem to be presenting?
Right. That's a great question. I can only speak from my experience, and that is I've been with Snowflakes for 8.5 years, and I do talk to a lot of people who call and say, we're just not comfortable having one of us be genetically connected but not the other. And so we've decided that we'd rather have no genetic connection than an unequal one. So I am positive that this is not true for everybody, because I know we have thriving sperm and egg donor programs in the U.S., but it seems that for some patients this is the case. Some of it might be linked to a religious background where they feel that they don't want to go outside of the marriage bond to create a baby. But when you look at embryo adoption or embryo donation, they feel more comfortable with that, because even though the embryo was created by somebody else, in their minds they can better think of it like adopting a child before they're born and just giving them the womb to grow in and the home, the family, but not using maybe her eggs and another man's sperm, or his sperm and another woman's eggs. That doesn't feel comfortable to them. So that's what I've heard from some people, and certainly not everybody feels that way, but I know it is a factor that drives people's decisions sometimes.
All right, thank you. There's a couple more here, Megan. Do you have a sense that clinics are becoming more or less open to educating their patients about embryo donation and adoption?
That's a funny question. I feel like some are on one side and some are on the other. More open, definitely, to educating patients about embryo donation because it's becoming more common. Less open to educating their patients on embryo donation because when the FDA kind of stepped in and made regulations, some clinics decided, you know, we don't want to deal with these regulations. We're not going to do this anymore or talk about it anymore. So I think it's going both ways, but it certainly is becoming more common. I know more people are talking about it online, and I think that clinics would, honestly, it would be wise of them to discuss it more often with their patients. So it's going both ways.
Okay. One more question here, Megan, that I see. How can we go about getting educational information about this topic so we don't have to create it?
Oh, yeah. No, we've created a lot for you, so you don't have to create anything. The Embryo Adoption Awareness Center, which is embryoadoption.org, and I think we have a handout at the end of this that we'll give you with that info. Anyways, it has a lot of resources. You can order things that are free because the Awareness Center is grant funded to create awareness around the United States about embryo adoption. So you can get brochures for your clinics or your programs that you can hand out to patients, and those are readily available. And they're nice brochures. You know, we're going to mail them to you. You're not printing them off yourself. Snowflakes is also perfectly happy to provide you with brochures for recipients and donors, and you can keep those on hand. And then we have all kinds of information depending on what you're looking for, as far as like counselors or patient education or helping patients come to the same page as what they want to do, or helping patients talk to their kids about embryo adoption or anything like that. So I would say, just if you don't see what you're looking for online, or if you just want to pick up the phone and call the Embryo Adoption Awareness Center or the Snowflakes program, would be happy to help you depending on your needs.
Okay. Megan, I see one more question. Have you heard from patients who complain about their clinics? Do they come to a program such as yours and vent? And if they do you still work with those clinics?
Let me think about this. I'm sure patients are going through a lot. So whether they're complaining about each other or their clinics or their finances, they are going through a lot. So I would say certainly we want to be referring patients to clinics that are reputable, but I think just because one patient has a negative experience doesn't necessarily mean we wouldn't put a clinic, we wouldn't work with a clinic, because certainly people are going through a lot and might have an experience that didn't necessarily fit with the clinic's standard protocols or whatnot. So I hope that answers the question.
Okay, and I don't see any more questions.
Okay.
So I'll wait.
I think there is one because I see it.
Do you have one that I don't see?
Oh, this one is the gestational carrier. This one says, yeah, I do. What do you think of some IVF clinics that don't inform their patients of the embryo donation adoption option? I mean, certainly it's a clinic's choice, but as we mentioned in the presentation, that the answer, I think, is that if patients are looking for another option that they didn't feel comfortable with what was presented at their clinics, they are going to go online. They are going to find out about embryo donation and adoption somewhere. And some clinics have the programs in-house, so they might go to another clinic for that program that they could provide, or they might go through something like Snowflakes, where they can still use the clinic that was, presenting them with their initial fertility treatment options, and then get embryos that were donated from another couple sent there. So I don't have any personal bias towards or against clinics that don't present the option. Certainly Snowflakes ends up working with more clinics who do present the option because they have talked about it with their patients. And I think the more open the clinics are to it, the better that Snowflakes can work with them and help make it a very smooth process for their patients.
Okay. So I don't see any more questions. If any of my panelists do see a question that we didn't ask, please pipe up. I'm unmuting you. And if not, I want to say to everyone, thank you for joining us. We will see you in a month for the legal issues of embryo donation and adoption. And we want to thank Megan very much and wish her much success with the coming birth of her child. So that's it for today. Everyone have a great day. Megan, did you want to say something?
No, I just said thank you. Well, I do find another question.
Oh,
Can I answer that one? Okay, it says, why do you think some IVF clinics don't inform their patients of the embryo donation adoption option? And that's a great question. Certainly everybody would have, just like every fertility patient has their own background and bias, I think clinics are the same. But I think some clinics might not do it because they think there aren't embryos available, so they don't want to bring up something that isn't really an option, they believe. So that's why we wanted to make it clear that there are embryos available. Other clinics might not bring it up, maybe because they think it costs just as much as IVF, and so why would we, do that if we could just do IVF? Maybe they don't bring it up because there's a lack of knowledge about the different programs, and so since they don't feel like they can speak educatedly about it, then they don't want to present it at all. I don't know. Those are just some things that I can think of off the top of my head, but it is important to know that it is an option, and if there are questions about the details or the resources, certainly the Embryo Adoption Awareness Center or the Snowflakes program could help with that.
All right. And with that, we'll close this. Thank you, everyone, and we hope to see you in a month. Have a wonderful day.